Dr. Jeff Waldrop from Hanson Chiropractic. Today I'm going to be doing some Graston on an individual who had a patellar tendon tear in his right knee. We've been working with him for some time to get him back active and doing activities again. And it's been doing really well. So I'm going to focus today. You can see the scar here where he had his surgery. So there's going to be a lot of scar tissue in this area here. Because he wasn't able to bend his knee for a long period of time, his quadriceps and his IT bands, as you can imagine, were extremely tight. So we've been working to loosen those up so he can get an increased range of motion, flexion of the knee, back to doing more activities. He's back exercising again, playing hockey, and he's about 90% better, according to him. So I'm just going to start with some lotion here. As I put the lotion on, I'm sort of feeling for areas where there are restrictions or little bumps in the tissue. Lotion just helps the tools to glide a little bit. We have 6 different tools depending on which area of the body we're working on. I'm going to start with this big one here. We're going to work distal to proximal here. And just sort of gliding through the tissue here. Little motions right here. There's a little bump. Usually to the patient that feels a little uncomfortable. So you use a fair amount of pressure, but always within the patient's tolerance. It should never be unbearable for them. But you want to try and break up the adhesions within the tissue there, the restrictions that don't allow the joint to move normally. How's the pressure there?
It's good.
And you can feel right there where there's the bump when I go over it.
Yep.
Yeah. And usually in the area where there's some adhesions, you can see it's turning a little bit red right there. You get some increased blood flow to the area as a result. So the area where there's the adhesions, you get a lot of that. Even though he's been coming for some time now, he's still active and he's still making these muscles work and building up some more scar tissue. Right along that IT band quadriceps connection there. Usually a lot of gunk. Just like to break that apart a little bit. Relax that down. Just sort of trying to separate the fibers here. So those tissues can work independently again. So he had a complete rupture of his patellar tendon, which required some surgery and a long layoff, during which time he couldn't really do a whole lot. But he got in here fairly quickly so we could start getting some motion into the joint. Like I said, I have different tools depending on what I'm working on here. This area right over the scar is a very sensitive area, and yet he also had some numbness in here for a long time. I think you still have a little bit of numbness in there?
Correct.
Yeah, but the area has gotten smaller around the surgical site. But it's still pretty sensitive, so I go pretty light because there's not a whole lot of tissue there. And his scar even looks a lot better than it used to. It used to be really raised and bumped, and now it's actually fairly level. So one of the hardest things he still has is full extension of his knee. So right in here in the medial quadriceps here. He still does exercises to strengthen this, which is important. Try and work on that last 10 to 15 degrees of extension. And I like to do all the way around the patella too. Make sure the patella is nice and moving, floating like it's supposed to. Good. And so that's all it takes. Just a couple minutes there. Now I'm going to work on his calves, because as he wasn't able to straighten his knee and walk normally, he was compensating by going up on his toes a lot. So he's got some other stuff on the posterior aspect of his legs that we're going to work on. Make sure he's nice and balanced out. Not too bad out there.
Not too bad, yeah.
A little more in there.
Yep. feels great. That's the amazing part of Graston. Feels so much better right after the treatment. It's not the most pleasant experience, but it's amazing how good it feels afterwards, immediately. Thank you.
You're welcome.